Hello, and thank you for tuning in to our presentation today regarding the development of interprofessional training program for opioid workforce for high need and high demand areas. The opioid epidemic has increased the need for more well-trained professionals focused on opioid use disorder, OUD. Unfortunately, the capacity of the existing behavioral health workforce to prevent and treat OUD, especially in underserved areas, is clearly inadequate in both size and training. The goal of this presentation is to describe the development and evaluation of a workforce training program that aims to increase access to healthcare and OUD in underserved areas. Our first steps included an assembling an interdisciplinary team from various schools and clinical partners to develop a comprehensive OUD-focused training with an emphasis on interprofessional collaboration provided to selected students in the last year of their clinical placements in a variety of behavioral health-based programs. This interdisciplinary team consisted of people from the fields of nursing, social work, counseling psychology, family medicine, addictions medicine, and psychiatry. This team designed and implemented a comprehensive program consisting of a didactic portion, including in-person seminars and supplemental online materials. As part of this didactic program, students also took part in extensive interprofessional group-based discussions. This is in addition to opioid prevention, treatment, and/or recovery-focused clinical placements. Our trainees come from the academic degree programs at the master's level, including social work, mental health counseling, rehabilitation counseling, school counseling, and school psychology. We also had doctoral level students participating in this program from school psychology and psychiatric mental health nursing. The didactic training program consisted of workshops presented by contact experts, including researchers, professors, practitioners, and healthcare policymakers. We provided the students with trainings in substance and opioid use disorders, co-occurring disorders, mindfulness, medication-assisted treatment, cultural competency, screening, brief intervention, and referral to treatment, SBIRT, motivational interviewing, cognitive behavioral therapy, CBT, and interprofessional education and practice. We were also lucky to have the Commissioner of Health for Erie County present on opioid use and its impact on the community. In this, they talked about the increase of SUD and OUD in the community, focusing on prevention, recovery, and treatment of SUD and OUD, and opioid use-related overdoses and fatal overdose deaths. In addition, we were able to get the Department of Health for Erie County to provide trainings on the administration of Narcan. This was done to both our trainees and other people in the community who were interested. For our clinical placements, we partnered with 9 clinical sites to provide OUD-related experiential experiences, including school-based clinics and integrated care facilities in medically underserved areas. As we developed the program, we also built in program evaluation through the use of RQCI, or RCQI. We used a mixed method approach to evaluating the program and its efficacy. Participants took part in focus groups at the beginning, middle, and end of each year, where they were queried regarding their experiences, expectations, and anything they would like to see be a part of the program, in addition to what they thought we did well, while also providing information on where the program can improve. In addition, the participants took part in assessments at the beginning and end of the program, which help us understand where they were when the program started and how the program has helped them understand any possible change and help in enhancing their understanding and attitudes to a variety of areas, including interprofessional education and collaboration, evidence-based practice, helpful responses, motivational interviewing, cultural counseling competency, clinical supervision, substance use, opioid use, and interprofessional collaboration. The preliminary findings indicate that graduate students in the training programs are satisfied with their training. We anticipate that upon completion of the training, students will develop improvement in their knowledge and skills in OUD-related prevention, treatment, and recovery, as well as interprofessional teamwork and cultural sensitivity in clinical settings. In conclusion, this program can enhance the behavioral health workforce capacity to deliver more highly skilled interprofessional and evidence-based OUD services to people in underserved areas. Our next steps are to continue recruiting a diverse cohort for Year 2 and Year 3, in addition to reviewing the program evaluation data from Year 1, and make any changes to the didactic and clinical experiences for future participants. We would be remiss if we did not take a moment and acknowledge our clinical partners. Without them, we would be unable to function. Also, we would like to acknowledge the Patricia H. Garman Behavioral Health Nursing Endowment Fund from the University at Buffalo School of Nursing. This funding has allowed us to go above and beyond with our training program. Lastly, we would like to take a moment and thank and acknowledge our funding agency, the Health Resources and Services Administration, HRSA, who made this program possible over this 3-year project. As a note, this content and any conclusions contained within are our own and are not to be construed as the official position or policy, nor any endorsements given by HRSA, HHS, or the U.S. government. Thank you for taking the time to review our presentation today. Thank you, and have a great day.